Rural Lap has helped thousands of rural and remote health professionals to take much needed leave to the betterment of their own professional development or to simply recuperate. Rural Lap provides an opportunity for these dedicated individuals who commit so much of their time and personal energy to the communities in which they work. This would of course not be possible without the hard work and dedication of over 400 Rural Lap locums that have contributed to 4,999 placements that occurred before this particular milestone that we are celebrating today. On behalf of Aspen Medical and Rural Lap, I would like to extend my gratitude to all of our locums for contributing to this significant milestone. I would also especially like to congratulate our 5,000th placement, Chris Leonard, who has filled 22 placements across rural and remote Australia.
As many of you would know, people who live in rural areas face a lot more difficulty in accessing the types of care that others can take for granted. And so it's with programs such as Rural Lap that the Australian Government's able to support and to try and provide that better access. We acknowledge that rural and remote health is built on the commitment and the expertise and courage of the health professionals that work in those areas, because it's quite a different scope of practice to what it is in metropolitan areas. The consolidation of 3 locum programs, which became Rural Lap, was done in 2016, and it was done so in an effort to reduce administrative red tape. And I think that Aspen's done a great job in moving this program forward. I'd just like to say thank you to everybody, and to ask Chris to come forward and accept this very special award for being the 5,000th locum placement.
Part of the reason I joined the Rural Lap program was to assist the drastic shortfall of nurses in rural and remote communities in Australia. All nurses need a break at some point for holidays or education to keep their skills up, and I guess I wanted to help them out. Well, I believe all Australians deserve a high quality of healthcare, regardless if they live in the city or bush, and the Rural Lap program enabled me to help my fellow peers in rural Australia by providing them with a much needed break for education and holidays. Just due to the gratitude that I'm shown, it really is an essential program. Without people like me willing to relieve them, the burnout rate of rural nurses in Australia would be much, much higher.